Dorothy is 71 years old and lives by herself in a small Vermont town. For 6 years, she has relied on the same Medicare Advantage plan, seeing the same doctors, using the same pharmacy, following the same routine, until one morning in late October when she opens her mail and finds a notice from her insurance company stating that her plan will end on December 31st. She reads the letter again and again, her hands trembling, then dials the customer service number and sits on hold for 47 minutes before someone finally answers and calmly tells her, "Your plan has been terminated. You will need to select new coverage." Dorothy manages diabetes and high blood pressure and takes 5 different prescription medications, and now the plan that helped her afford that care is disappearing. She doesn't know what steps to take next, and what makes the situation even more frightening is something she doesn't realize at all. She effectively has only 63 days to secure her position, and if she misses that guaranteed window, she may never be able to purchase reasonably priced Medicare supplement coverage again. If you are enrolled in Medicare Advantage right now, or someone you care about is, please do not scroll past this, because I'm going to walk you through one of the most serious waves of Medicare disruption we've seen. In 2026, nearly 2.9 million older adults were moved off their Medicare Advantage plans, roughly 1 in every 10 enrollees nationwide. In this video, I'll break down why this is happening, outline 3 key forms of legal protection that federal law gives you, and share a clear 3-step action plan you can start today to reduce your chances of losing coverage, doctors, or savings. And I especially need you to stay to the end, because there is a common but often overlooked mistake in this process that can permanently close the door on supplemental insurance. Let's look at Robert's experience next. Robert is 68, retired 3 years ago from a public works job, and lives in a small South Dakota town with his wife, Linda. When he turned 65, he chose a Medicare Advantage PPO that had a 0 premium and seemed to include everything he wanted: his doctors, prescriptions, routine dental cleanings, even a gym membership, and he felt confident he had picked well. In September of last year, he received his annual notice of change. On page 4, buried in small print, was a sentence explaining that his plan would no longer be available in his county starting January 1st, 2026. He saw it, understood the words, but didn't worry, assuming he could just switch during open enrollment, and that's what he did. He found another Medicare Advantage plan from a different company with similar advertised benefits and enrolled in November. The turning point came from what he didn't realize. His new plan used a completely different network of providers. The cardiologist he had been seeing for 9 years was not in this network. His local hospital was not in it. The specialty pharmacy that managed his blood thinner prescriptions wasn't either. When he arrived for a cardiology appointment in January, the office informed him that the visit would be billed as out-of-network, and his portion would be $412 for that single visit. Alarmed, Robert decided to switch back to original Medicare so he could see any doctor who accepts it, and applied for a Medigap policy to help cover copays and coinsurance. But the insurer asked a series of health questions, reviewed his heart condition and medications, and ultimately declined the application. The reason was technical but crucial: his 63-day guaranteed issue period, during which any insurer would have been required under federal rules to sell him a Medigap policy without medical underwriting, had already been used when he moved from his first Medicare Advantage plan into the second one. He hadn't been told that was an important choice point. Now he has original Medicare with no supplemental policy. Under original Medicare alone, there is no annual out-of-pocket cap, so if he ends up with a major hospitalization this year, his share of the costs could easily be tens of thousands of dollars, $50,000 or more in a serious case. This kind of situation is not rare. It is happening across many communities, and understanding your options can make a critical difference. Stepping back, here is the broader context. Medicare Advantage plans are offered by private insurance companies under contract with Medicare. By law, they must cover at least what original Medicare does, but they have significant leeway in designing networks, setting rules for prior approvals, and determining cost sharing. Importantly, these companies are allowed to discontinue a plan at the end of a contract year, as long as they follow notice requirements, and in 2026, many plans were not renewed. Research by the Kaiser Family Foundation indicates that about 2.66 million people with individual Medicare Advantage prescription drug plans in 2025 had those plans end at year's close. Another analysis, published in a major medical journal and discussed by Johns Hopkins University, estimated that when all plan types are counted, roughly 2.9 million people were affected by plan terminations. That works out to about 10% of all Medicare Advantage enrollees. From 2018 through 2024, the average share of enrollees affected by such non-renewals was about 1% each year. In 2025, it rose to nearly 7%, and in 2026, it reached 10%, a tenfold increase over just 2 years. The impact has been concentrated in certain areas. Rural states were especially affected. Vermont saw around 93% of its Medicare Advantage enrollees in plans that ended, Wyoming about 65%, South Dakota roughly 64%, Idaho about 63%, New Hampshire around 61%, North Dakota about 60%. In Vermont, more than 2/3 of those whose plans ended now have no Medicare Advantage options available at all in 2026. There simply is no other private plan to join. Analysts point to financial incentives and regulatory changes as important drivers. The Medicare Payment Advisory Commission has estimated that in 2026, payments to Medicare Advantage insurers exceeded what traditional Medicare would have spent on the same beneficiaries by roughly $76 billion. As policymakers began examining ways to reduce those extra payments and as use of health services grew, some insurers decided certain plan designs, especially in more sparsely populated areas or specific PPO configurations, were no longer financially attractive, so they chose not to continue those contracts, often in regions with limited alternatives. At the same time, a second problem is playing out within remaining plans: higher levels of denials. In 2024, Medicare Advantage plans handled about 52.8 million prior authorization requests, cases where the plan decides in advance whether it will cover a recommended treatment. Of those, an estimated 4.1 million were fully or partially denied. Publicly available data suggest one large carrier, United Health Group, had an overall denial rate of around 12.8%, and for categories like home health and post-acute care, the services someone might need after a hospital stay, the initial denial rate averaged around 15–16%. What's crucial is what happens when those decisions are challenged. When beneficiaries appealed, more than 4 out of 5 denials, about 80.7%, were overturned in favor of the patient. Yet only around 11.5% of people whose requests were denied actually submitted an appeal, meaning that out of roughly 3.6 million denials per year, a large majority were never contested. Based on those reversal rates, roughly 2.9 million of those unappealed denials might have been approved if the person had filed the paperwork. In other words, many older adults are missing care they may be entitled to simply because they don't realize they can push back. Now, let's go through the protections that do exist. The first is your guaranteed issue, right to purchase Medigap coverage. If your Medicare Advantage plan ends, stops serving your area, or you move outside its service area, federal law typically gives you a guaranteed chance to buy certain standardized Medigap plans, often plans A, B, D, or G, with plans C and F also available if you first became eligible for Medicare before January 1st, 2020. In a guaranteed issue period, a Medigap insurer must accept your application, cannot deny you because of existing health conditions like heart disease, diabetes, or cancer, cannot charge you extra solely because of your health, and must cover pre-existing conditions immediately without a waiting period. The limitation, and this is where many people get caught, is that you usually have only 63 days from when your Medicare Advantage coverage ends to exercise that right, although you can often apply as early as 60 days before the termination date if you know it is coming. Once those 63 days pass, the federal guaranteed issue window generally closes, and in most states, there is no federal rule that reopens it. This is why it is essential to save every notice and envelope from your plan, as that documentation can help establish dates and eligibility. The second protection is a special enrollment period, SEP. When your plan is not renewed, you're given an SEP, often from December 8th through the end of February, to either switch to another Medicare Advantage plan, if available, or return to original Medicare with a standalone Part D drug plan. If a plan terminates in the middle of a year, the SEP usually starts 2 months before and ends 1 month after the contract termination date. Separately, there is a Medicare Advantage open enrollment period each year from January 1st to March 31st, during which people already enrolled in MA can make one change, either move to a different MA plan or drop MA completely and go back to original Medicare, and typically add Part D. The third protection is the formal 5-level appeals process. Anytime a Medicare Advantage plan denies a service, medication, or prior authorization request, you have the right to appeal. At Level 1, you request a reconsideration from your plan. You typically have up to 65 days from the date on your denial letter to send this in, and the plan must respond within specific timeframes, usually within 30 days for standard pre-service appeals and within 72 hours if health could be seriously harmed by a delay and you request a fast appeal. If the plan upholds its decision, the case is forwarded at no cost to you to an independent review entity at Level 2, which works under contract with Medicare, not with your insurer. If you still disagree, you can seek a hearing before an administrative law judge at the Office of Medicare Hearings and Appeals, Level 3, then possible review by the Medicare Appeals Council, Level 4, and in certain situations meeting specific dollar thresholds, you can pursue the matter in federal district court, Level 5. Throughout this process, you can authorize someone, a relative, friend, attorney, or even your doctor, to help file and represent you. And in many situations, the disputed charges are not collected while the appeal is pending. If you're in a hospital or skilled nursing facility and receive a notice that the plan will stop paying for your stay, there is an accelerated option. You can contact the Beneficiary and Family-Centered Care Quality Improvement Organization, BFCC-QIO, using the phone number listed on your Important Message from Medicare notice. The QIO generally has to decide your case within 1 calendar day, and your coverage continues during that review. You cannot be discharged based only on the plan's initial ending of coverage. There is also a newer safeguard in 2026. Medicare's Plan Finder tool on Medicare.gov now includes information about provider networks. If you choose a plan based on the doctors, it lists as in-network, and then within the first 3 months, you discover that information was wrong and your doctors are not actually in-network. You may qualify for a one-time special enrollment period to change plans or move back to original Medicare. To put this into action, here is a 3-step plan many advisors recommend completing within the next week. Step 1. Check your current coverage. Go to Medicare.gov and use the Plan Compare feature to log into your Medicare account, review your existing plan, and look for any notices or changes. Use the plan's online provider directory, or printed version, to confirm that your primary doctor, specialists, hospital, and pharmacy are still listed in-network. If anything appears inconsistent or confusing, write down the details, take screenshots, or print pages if you can. That becomes evidence if you need to challenge something. If you don't use a computer comfortably, call 1-800-MEDICARE, 1-800-633-4227, TTY 1-877-486-2048, and ask the representative to help you check your coverage and options. Step 2. If your plan has been terminated or you have been denied care, submit the relevant forms promptly. If your plan ended and you have not yet tried to enroll in a Medigap policy, count the days since your Medicare Advantage coverage stopped. If you are still within 63 days, contact insurers in your state who sell Medigap and clearly state that you have a guaranteed issue right because your MA plan ended. They are required under federal rules to sell you a policy in that situation. The Medicare.gov site has a Medigap search tool listing companies by state. If you have had a service or authorization denied, file your Level 1 appeal within the allowed time frame by following the instructions on your denial notice, including your name, Medicare number, details about what is being appealed, and any explanation from your doctor. If waiting poses serious health risks, ask for an expedited appeal. Keep in mind that a large majority of appeals succeed, so a denial is not necessarily the final word. Step 3. Contact your State Health Insurance Assistance Program, SHIP. Every state operates a SHIP, which offers no-cost, unbiased advice about Medicare coverage and rights. A SHIP counselor can help you understand your situation, compare available plans, walk you through your guaranteed issue protections, and assist with appeals. You can find contact information at shiphelp.org or by calling 1-800-MEDICARE and asking to be connected to your state's SHIP. If you are the adult child or close relative of someone with Medicare, consider making that call together. Many older adults find this process overwhelming, and the 63-day Medigap window continues to run whether or not they feel ready. Before you go, know that rules around Medicare, Social Security, pensions, and senior benefits in general are changing more quickly than in past years, and online platforms do not always show you every update even when you follow a channel. That's why in the video description, you'll find a link to our Global Senior Alerts official WhatsApp channel, where you can receive timely notifications when new rules, deadlines, or warnings could affect your benefits, along with a free Senior Benefits Protection Guide that summarizes key timelines, appeal deadlines, phone numbers, and websites mentioned here, so you can print and keep them handy. Please think about the people in your life who rely on Medicare, parents, neighbors, fellow congregants, or someone at a senior center who may not have anyone explaining these details, and consider sharing this information with them, whether by sending a link, discussing it over coffee, or helping them make calls, because awareness of that 63-day window and the right to appeal can be the difference between having coverage and going without. If you found this useful, you can support Senior Money USA by subscribing and turning on notifications so you don't miss future videos, and by sharing your experiences with plan changes or denials in the comments. Others can learn from what you've gone through. This video is for general education and information only and is not legal, financial, or medical advice. For guidance on your specific situation, always consult Medicare directly, your state health insurance assistance program, and qualified legal or financial professionals.